Okay, this week's readings focus on the global issue of food poverty, which has significant implications for lower income individuals. For the purpose of this presentation, we are following Carahat and Convener's 2016 definition of food poverty, which is where constraints are such that it is not possible for individuals or households to consume a nutritionally adequate diet, they could be considered to be in food poverty. With this in mind, let's go to our first question. Who is actually at fault for an individual's diet?
I think blame must be put on the state for an individual's poor diet. I think that governments insufficiently educate their populations about nutrition. In modern society, people are constantly confronted with endless fast food adverts and confusing nutrition claims. Adults and children are also generally not really taught about nutrition and how to eat properly. Increasing education on a balanced diet and how to eat healthily will instantly improve people's diets. The UK government in June had tried to kind of increase its efforts to educate its population. It's been put on all fast food advertising a ban for 2023 in order to try and limit obesity. But I do question how they'll be able to change the habits of so many people.
Totally. I completely agree. I think governments have a duty to ensure there is enough food in the country so people can have a balanced diet. Governments are in control of policies and imports that help create the food supply. Tawad's era showed that a badly run government program in Zimbabwe called the Fast Track Land Redistribution Program meant national food production significantly declined in 2006. The government here created conditions whereby there was insufficient food in the country and people couldn't afford to buy it. And therefore, there was nothing an individual could do to change this.
The impacts of poor governance is a problem that COVID exemplified because during COVID, HGV driving tests couldn't occur, meaning finding new drivers was difficult, and as a result, food couldn't get delivered in the UK. And this meant that supermarket shelves were empty and balanced diets were difficult to maintain.
Yeah, I agree. And so does Kaplan when he says that governments have not taken enough responsibility for food poverty. He argues 20th century neoliberal and austerity policies often mean that solutions to society's problems being handed over to voluntary organisations like food banks and business food retailers. Therefore, according to Kaplan, governments are at fault for an individual's diet, and they are just neglecting the responsibility and not helping to solve the problem.
Yeah, I think you're right that government are definitely at fault. However, there is still an argument for it being an individual's fault because a person's upbringing has a huge impact on the future diet. Manella suggests that what a mother eats during pregnancy influences the child's future diet. Her studies found that the amniotic fluid surrounding the infant contains certain flavours that the mother digests. The fluid is a rich source of sensory exposure, and this means the food gets passed on to the infant, and this will affect what the child likes and dislikes in the future.
Interesting. I've got another way. This one doesn't really seem to be the kind of fault of the parents, but it does have a significant impact on an individual's diet.
Okay, go on.
A parent's socioeconomic background has a huge impact. If someone has a wealthier background, they're more likely to have a healthier diet and consequently food habits. This is because they have a higher income, they can afford organic and healthier foods, and they're accessible to them. Whereas people with lower socioeconomic backgrounds often have less consistent nutrition intake because of their own financial situation. Kaplan also blames individuals for their own diet because he believes the food donations in supermarkets depend on the individual. People who are low paid and struggling themselves often give less food. This means that at food banks, there's firstly little food, but also there's not really the variety someone needs to achieve a balanced diet.
Yes, that is very interesting. I also saw in that reading that people have now internalized the idea that going to the food bank is a personal failure. People have started not going to food banks, and this means they either don't eat enough or they don't get a balanced and nutritious diet. Kaplan found that in a small cafe in Wales, which recycles food, people don't want to go because others will think they are poor and a failure. Individuals also view the food as leftovers and are suspicious of the food because it couldn't be sold to retailers.
Right, okay. I never really linked people's perception and the stigma associated with food banks with an individual's diet. Another factor is the supermarkets. Mosley has argued that ever since the 1960s, supermarkets have been misleading consumers. Mosley has found that over the last year, supermarkets including Sainsbury's, Tesco's and Morrison's have been falsely branding products which are high in salts and saturated fats as healthy. This means certain consumers may have thought they were eating healthily, but actually their diets are still unbalanced.
Yeah, I agree that supermarkets have had an impact. But I think we can kind of all agree that the state is the actor most responsible for the individual's diet. This is because they are the one which is able to determine the extent to which other actors like supermarkets are able to exploit free solutions.
Yeah, I completely agree. I think this leads us nicely onto our next question, though. Does the free market enable long-term marketable solutions to food policy?
I think that the rise of neoliberalism since the 20th century raises a further question. Can the free market and trade liberalization lead to long-term solution to food poverty? I mean, since the 20th century, we have seen the liberalization of trade and markets around the world, resulting in unhealthier consumption patterns globally, especially in developing countries. This process is called the nutritional transition, where Anne-Marie Thoreau highlights there has been an increased consumption of processed foods, including more sugar, fats, and decreased fiber, resulting in an increased burden of chronic diseases like heart disease.
Yeah, and in addition to that, we're seeing that due to the increased competition globally for food, there's been a race to the bottom, resulting in increased cash crops, altering the land dynamics of traditional farming, and increased focus on monocultures, therefore neglecting other industries domestically, causing less varied and balanced diets, as well as causing structural shifts in terms of labour forces, causing unemployment and the worsening of food insecurity as large corporations are able to prosper.
But is the effective liberalisation of markets such a bad thing? It does mean we see cheaper food globally, potentially meaning less people go hungry. Also, through competition, it forces companies to innovate, creating new technologies that may see the creation of healthier modes of production becoming more mainstream in the future. Surely that's a good thing.
Okay, but linking back to our previous question, looking at individualism versus the state, people often don't really have the ability to maintain a healthy diet due to a variety of socioeconomic, political, and cultural factors, meaning that whilst food might be cheaper, the quality of diets is deteriorating, showing how we are seeing marketable solutions, but not necessarily long-term solutions as a result of market liberalization. We therefore rely on governments or policymakers to maximise the benefits of trade liberalisation and minimise the negatives. Understanding the effects of nutritional transition will allow these policymakers to mitigate possible nutritional impacts by restricting consumption of certain processed, high-fat, sugary kind of products.
Yeah, okay, I think I agree with you there. We are seeing a similar trend to the nutrition transition nationally in the UK. Following from austerity and welfare reform since 2010, which also represents how markets at a national scale are becoming increasingly free and liberalised. In the Lumbury, Mumford and Green Reading, they highlight how austerity has led to the state putting increased emphasis on individual accountability, therefore allowing the free market to solve issues of hunger.
Yeah, but we have seen that austerity policies have led to a significant increase in food insecurity nationally, especially amongst the poorest families with children. The rise in food poverty has therefore relied on a lot of charitable support through projects like food banks. We've seen recently with huge media attention given to Marcus Rashford and the work he's done supporting children with free food, that the problem is still very significant now, and that free market solutions are not really providing a long-term solution to food insecurity. And whilst community responses are there, they don't address the structural issues associated with food insecurity and poverty.
Yeah, so whilst aid and support is good, I agree that it isn't a long-term solution. So far, liberalisation of markets nationally and globally clearly hasn't been able to solve issues of food insecurity, as we see the poorest people in society are often left behind. So we therefore do require some kind of government intervention.
However, the extent to which they are required still remains uncertain, as we have seen with the historical examples of command economies like the Soviet Union in the 1920s and 30s. Too much intervention resulted in huge-scale famine and deaths, suggesting that there is a need for a kind of balance between government intervention and the free market to help solve the issue of food poverty.
So ultimately, we were left to question, is it beneficial to undertake studies in food poverty?
Studying food poverty is a beneficial indicator of food security, or a lack of, as the two are related. For example, does an individual have enough funds to guarantee the purchase of dinner next week? However, studying food poverty can also allude to the level of development and prioritisation the state has for its citizens.
From undertaking research into food poverty and associated distributions of food deserts, these are the areas lacking healthy and nutritious foods. The topic seems to constantly return to the fundamental underpinning of state failure and a lack of state resources for distribution. In a place like the UK, it's not an issue of lack of physical food existing, Instead, it is the issue of economic barriers which prevent certain minority groups from accessing fresh, healthy, and nutritious food options.
Through food poverty studies, we can compare the number of food banks or fast food outlets present. Where this has dominated the state has either announced its responsibility, leaving charitable food banks to deal with provisions, or the state has allowed and encouraged the invasion of TNCs and fast food options.
I completely agree with that, Archie. And we can use the presence of these food banks as an indicator to the extent which food poverty is present to see if a society is wasted, a term Caraher uses for when a state fails to or doesn't really attempt to provide food provisions for those in need, which is quite frankly awful. When there are any amount of food banks, the Scottish Parliament Welfare Reform Committee says that the area has a Dickinson model of welfare, certainly not something which should be present in our modern and supposedly developed societies.
In instances where the state does not have the resources to provide adequate food provisions, there is often still an opportunity for the market, and especially TNCs, to fill the void.
By utilising the lens of food studies, one is able to recognise the foodways, the practices of those residing in food deserts, such as cultural, social, economic food desires and habits, which constitutes the opinion held by many, especially lower income individuals, that food is regarded to be a flexible expenditure, or as Kaplan words it, elasticized in their budget.
In his 2012 article, Sabitka shed light on some assumptions of progressives prior to the emergence of in-depth food studies. It was commonly thought that individuals living in fast food deserts eat junk food, as they are lazy and uneducated. However, the 2013 article by Alcon et al., which explicitly explores food poverty, shows that the factor of food prices is what creates obesity in these environments, and that the individuals do in fact have agency. And when circumstances allow, an individual of lower income will leave their food desert and go to the supermarket, opting for healthier choices if they're affordable. By studying this insight and comparing nations and regions, one can infer about the lived experiences of civilizations.
However, such a study process and way of classifying people does have shortfalls. When looking from a supply-sided approach, Greenhalgh's 2012 paper proposes that individual eaters who we recognise to have agency can be villainized, particularly by the mass media, with the blame for their food choices being the result of a lack of self-control. Furthermore, Kirkland critiques the fact that these approaches fail to shift responsibility from the individual to the state. This re-emphasises our first question of who's at fault for an individual's diet.
For food poverty study to be generally reflective, it must be multifaceted, gathering data on topics which may be challenging to document, such as the built environment and how many generally accessible and affordable food shops surrounding the area where they live.
Many studies of food poverty have led to mixed outcomes, varying by geographic region and precise focus. Furthermore, current food studies only consider either supply-sided or market-based approaches, without considering other variables, such as access to healthcare and how this may interplay with food poverty.
Ultimately, the food poverty and food desert literature which I encountered is dominated by an attempt to try and link demographic, economic, and spatial data with health outcomes like malnutrition. But it's done with very little attention to what values and factors actually matter to people, effectively taking the human element out of human geography. Therefore, I find myself questioning the validity of such a newly emerging form of study, which produces no singular kind of common conclusions or theoretical framework.
Yeah, that's really interesting to hear. However, I do also believe that having an understanding of how food systems work and affect different groups of people has the potential to influence policy and advocate change nationally and globally. With that said, let's conclude. I believe we all agree that ultimately food poverty is the fault of the policymakers nationally and globally. Using the UK alone as an example throughout our discussions, we've seen that food banks and TSCs have been able to exert influence over individuals' access to foods. However, this is only under the pretense in which the government fails to provide an adequate service in the first place.
However, as we have discussed, market liberalisation, encouraged by the World Trade Organization, is what motivates the state and policymakers to act in the way that they do.
Using food poverty studies and paying particular attention to foodways enables a wider understanding of what relationship people genuinely have with food, regardless of what assumptions may be imposed on them.
And from these food poverty studies, we're able to learn what services are being offered in an attempt to reduce food poverty. What does become clear is that none of the current solutions address the structural issue. Instead, they just provide short-term support or service, which is why food insecurity remains prevalent. The government or some international organisations such as the WTO are really the only actors able to influence the structural cause of the issue, allowing for national and global change solutions.